taken by what you were saying about embarrassment and how the healthcare professionals felt embarrassed about asking about sexual functioning. I mean, how could practitioners overcome these feelings of embarrassment?
I think, obviously a lot of embarrassment is down to individual personalities, so some people will be naturally more readily embarrassed than others. But I think one of the ways that I remember I overcame my embarrassment at asking questions about sex was, first of all, observing clinicians who are already confident at asking those sorts of questions and seeing the way they approach something, and then perhaps considering for myself whether or not I could emulate some of that. Then I would practice talking about sexual concerns with patients of different ages, and I would speak to both male patients and female patients, and again get feedback from them as to how that was, whether they found it easy to answer the questions that I was posing to them. But I think the key thing for me is that you have to find your own language. So I might watch somebody and think, oh, that's a really good way to ask a question, but actually I need to then make it my own, because it has to be part of my personality and the way I would naturally approach questions. So I guess that's how I overcame my embarrassment, was lots of practice and trying to find my own way of expressing things rather than totally copying somebody else.
That's really interesting about finding your own language. I wondered, could you give us some tips about how to ask questions about sexual functioning?
I mean, to begin with, I guess you've got to at least be a little bit aware of what are the common problems or difficulties that patients might encounter. So it starts off, I guess, of knowing the subject a little bit, knowing what kind of male sexual difficulties are common after cancer treatment, and again what kind of female difficulties, because that gives you a baseline knowledge and confidence from which to start off. Then I guess what I would say is I would use what I would call a funnel approach, because you don't dive straight in and ask very direct, intimate questions, because they're likely to embarrass both yourself and the person that you're asking. I guess I would start off, I suppose, to begin with, something like I would ask them generally about their relationship and whether they'd noticed that their relationship had been under any particular strain or pressure since their cancer was diagnosed, and how did their partner feel about them being treated for this illness, and just get a feel for what the relationship is like, because the relationship is the context for then asking more intimate questions about how the sexual aspect of the relationship might be. So then once I'd asked a general question about relationship and got a feel for how the couple were together, or whether the person was actually in a current relationship or not, then I might then say something like, some people find that their cancer treatment has had an effect on the sexual aspect of their relationship. Is that something that has concerned you? And again, then just see what kind of feedback you get. So progressively you're making more intimate questions as you go through, but you're taking the response from the patient as an indicator as to how far and how fast you can actually progress to become more specific in the sorts of questions that you're asking.
And one last question. You mentioned structured assessment related to sexual well-being. Could you tell us a little bit more about that?
Within general sexual health, there are lots of validated questionnaires that can either be used by a clinician to structure the conversation that they have with a patient, or can be used by patients to answer questions about their sexual well-being before they actually are then seen by the clinician who's going to be providing their treatment. And in many ways, some of these have got some indicators that we could use within oncology. So although there aren't structured questionnaires about sexual well-being in general use within oncology, the research that I've been undertaking for my PhD and research that I'm currently doing is looking at what kinds of questions might be useful for different groups of patients, either for patients to fill in themselves and then use that as a basis for a conversation with the clinician, or to actually structure the conversation that the clinician has with the patient. So then instead of trying to find those difficult questions, they're already written down and they're following, if you like, a natural pattern of a conversation that'll actually help the clinician and the patient broach the subject and actually get into the conversation about sexual recovery in a way that is less threatening and less awkward for them to address.
So this is one way that it can help the patient as well as the clinician, where they complete a a questionnaire before the consultation.
Yeah. I mean, I guess it'll depend on each individual setting as to how they use a structured questionnaire, but the way I would envisage it working is that the patient might be given the questionnaire in advance, maybe while they're sitting in the waiting room, and they can either fill it in as a paper questionnaire or they might fill it in online on a touchscreen computer, for example, and they would just be filling in those questions. Now, those questions might be solely to do with their sexual recovery after treatment, or they might be broader and they might be about the different types of side effects that their treatment has caused them, some of which are sexual, some of which might be to do with bladder function or bowel function. And through them filling in that questionnaire, that information can then be transmitted through to the clinician in advance of the patient going into the consultation, so they can bring it up on their computer screen, read the answers that the patient has given, and then use that as a way to guide the conversation so that the consultation becomes more patient-led rather than clinician-led.